Hello, good morning.
Hi.
Hi. So we're just giving the co-host permission. Do you have any slides to share with us?
Are you speaking with me, Dr. Arora?
Yeah. I'm
okay.
Dr. Piali.
I do have. I will share my screen while I'm presenting.
Right, ma'am. We will be just giving you the link for the co-host permission so that you can share your slide as well.
Okay. Hi, Nidhi.
Hello, Ziba. Good morning.
Good morning. Good morning to everybody.
Ma'am, you are the presenter now. You can share your slides.
All right. I will do that.
So, Nidhi ma'am, with your permission.
Yes.
With your permission, we can start today's proceeding.
Should I welcome Ziba first?
I think she
Formally?
doing that.
Okay.
Good evening to all the participants, and especially good morning to Ziba ma'am. I, on behalf of the organizers of the mega event on mind body fitness, extend a warm greeting to one and all. It is indeed a distinct honor for me on behalf of entire fraternity of Government Degree College Sidra Jammu, Government Degree College Chinani Udhampur, Government Degree College Basoli Kathua, Government Degree College Kakriyal Katra, to welcome our esteemed principals of all the colleges, revered resource person of today's webinar, our worthy faculty members of all distinguished colleges, dear students, and all distinguished guests who has joined us in this virtual platform on day 4 of this event. A sound mind in a sound body, a proverb with Greek origin, rightly lays stress on the fact that a human mind and body should be both healthy and sound, that is, free from disease and pain. Body and mind are intricately connected with each other and allows us to have a satisfied and meaningful life. Thus, the theme of the mega event is holistic health. A healthy early development years that we experience plays a significant role for the wholesome life ahead. Thus, to maximize the child's future well-being, it is important to understand their basic physical, psychological, and social needs. To have a better understanding in this area, our today's session is focused on early child development and its role in mental and physical health. Before I hand over this platform to our speaker of the day, I request our principal ma'am, Dr. Nidhi Kotwal, to present a welcome address to the gathering. Ma'am.
Thank you, Shiv. Esteemed principals, participants, and their students. It's a glorious moment to extend my warm wishes to you all on behalf of Government Degree College Basoli and the organizers. I want to convey my heartfelt gratitude to Dr. Ziba Vaghri for accepting the invitation and being a resource person for this webinar on holistic health. Dr. Ziba Vaghri is an associate professor at the University of New Brunswick, St. John campus, and the director of CIHR-funded Global Child Research Program. She
I think there is a network problem.
Shiv, you can just introduce Ziva ma'am, and then we can start with today's proceeding.
Yeah. Thank you, ma'am.
experience.
Today's resource person, we are honored to have Dr. Ziba Vaghri with us, Associate Professor at the University of New Brunswick, St. John's campus, and Director of CIHR-funded Global Child Research Program. She has over 2 decades of extensive global health research and international experience in the areas of early child development and child rights, and is one of the leading scholars in creating linkages between the two fields in Canada. She is also the leading scientist behind the Early Childhood Right Indicator. As a global health researcher, she is in the field of health, child health and development. Dr. Vaghri has worked with various international development agencies like UN agencies, including the United Nations Committee on the Rights of the Child, the World Health Organization, UNESCO, UNICEF. She has also implemented groundbreaking knowledge translation activities such as the Global Child Rights Dialogue, which sought the insights and opinions of over 2,000 children from 43 countries across the world on their rights under the CRC. Dr. Vaghri is the lead author of Attributes of the United Nations Convention on the Rights of the Child, Analysis for State Compliance, as well as the Manual of the Indicators of General Command 7, Implementing Child Rights in Early Childhood, which was digitized into ECRI. Now, I request Dr. Vaghri to start their presentation. Welcome, ma'am, and over to you.
Thank you very much. It's a pleasure to be with you all. Good morning, good afternoon to you. My gratitude also goes to Dr. Saraswat and Dr. Nidhi Kotwal, who has expressed interest in my line of research and has invited me. I am pleased to be with you all, and morning I will just try to give a glimpse of what the 2 decades of my work has been in the area of early child development within the time limit that we have. I am going to try to share my screen and go with a set of slides. Do you see my screen? No?
Yes.
Not yet. All right. This is Zoom, right? This is a Zoom we are using.
This is Cisco, ma'am. You have just
Cisco
you are
WebEx.
looking at a share button. You have to just share your screen by using that share button.
Yes, there is no share button in my screen. That's what I'm used to usually in Skype or in Cisco Web, in Teams and Zoom. There is a share button. Now here, when the share button is deactivated, there is a share button, but it doesn't allow me to share. I think whoever is the host of the meeting has to allow me to share.
You are already allowed, ma'am. You have just to share your screen by clicking the share button.
So do you see my screen now? Do you see my slides?
No.
No, because the share screen is not active. The share button is open system preference. Okay. Okay. I think I'm going to email my presentation to you, Nidhi, and
Okay,
then
fine.
you can just move the slides as I speak.
Okay.
It's not the ideal, but this is a solution in the interest of time. I hope that your mailbox accepts this, because it may be heavy for your mailbox. It has lots of graphics and pictures. In the meantime, I will continue to.
Fine.
It did go through.
Ziba, I think you should continue. I'll open your slides.
Okay. You got it?
Yeah, I'm opening it. It will take some time.
All right. So today I like to speak about early child development and what a key determinant it is in setting up the tone of health in every domain of health for everybody. If we get the early years as in 0 to 5 or 8 before a child goes to school, if we get it right, we have put this individual on a right track. So I start by a saying of a great leader that walked on earth, Mahatma Gandhi, that says, if we are to reach real peace in this world, and if we are to carry on a real war against war, we shall have to begin with children. That is the significance of childhood. Similarly, John Milton says childhood shows the man as morning shows the day. And finally, Bill Gates, this famous entrepreneur of our time and era, says the first 5 years have much to do with how the next 80 years turn out. So be it a leader, a poet, or an entrepreneur, everybody agrees how significant these years are. They are not just significant to human health, to population health, they are also determinant of society's financial well-being and economic prosperity. So I am on slide number 4, Nidhi.
Okay, fine.
How is a child is developed to an adult? So we can go to next. The human capital theory tells us in order for a child to go from capital 1 to human capital 2, it has to undergo human development. And in this development, there's material goods, there is service input, there is parents' time, parents' human capital, others' human capital, and others' time. So many factors influence the process of child going through human capital 1 and turning into an adult human capital 2. So
Excuse me, Ziba, can you see the slides?
I can't see.
Can you see the slides?
We cannot see the slides.
Yes, okay, perfect. So, so there are many factors in this process, some of them modifiable, some of them not modifiable. But also, we know that the early part of this process, my voice is echoing. I think if everybody, all the colleagues mute except Nidhi, maybe we won't have echo. Okay, next slide.
Can everyone see the screen?
Yeah, I can.
Okay, fine.
So we must safeguard childhood, and to safeguard childhood, in 1989, the global community got together and produced what we know today as United Nations Convention on the Rights of the Child, because we thought in order to protect childhood, there should be rights articulated for children, and these rights, if they are fulfilled, children will be in a better situation. Next. Next slide.
Excuse me, Nidhi ma'am, the slide is not visible in our screen.
It's not visible at. Acha, I should share it with you all.
Yeah, you can share the slides to the host or to me or anybody else so that we can also just try it from our ends.
Okay, I'll just try.
Now it is visible.
Okay.
It is visible now.
Up visible. But now she cannot see. What's happening?
I think, Nidhi ma'am, you can go ahead with the slide presentation. It is now visible in our screen.
Ma'am, just open this file that you have downloaded. इसको open करो एक बार बस.
Can you see it now?
The screen is visible, but the slide is not open.
You have opened it in some other page. आपने गलत कर दिया. इसको करते हैं. खुला कहाँ है आपने?
Antariksh, if I request you if you can guide ma'am so that the thing can go on.
Ma'am, just forward this mail to me, please. I'll be taking care of it.
Email it to you.
Ma'am, Ziba ma'am, if you are able to listen to me, please try to share at your own end. There is a share button at the bottom of the screen. Just click that share button.
Yeah, I know, I'm familiar, but it doesn't allow me to share.
Yeah, ma'am, just try to share the content once.
It doesn't allow me. The share button is not active at my end. There is a share button.
We have provided you all the permissions, ma'am. It must be.
I know, but
Is
it's
it?
still.
Can you people see our screen now?
Yeah, ma'am, it's visible now.
Now it's visible. Okay, Ziba, please continue.
Okay. So this wasn't this slide. The next slide. So the Convention on the Rights of the Child was developed in 1989 to safeguard the children. Next. To this day, 196 countries have ratified this convention, and by virtue of ratifying the convention, they are obligated, the governments are obligated to safeguard children's rights. Next. Children's rights are articulated in the form of 3 P's of rights: right to protection, right to participation, and right to provision of services such as health service, education, protection, and then right to survival and development. Next. So all these articulated to help every child to develop to its full potential. That is the central thesis. But are children developing to their full potential? Next. Not every child is developing to full potential. This is infant mortality rate of for about 1,000 child across the world. As you can see, it varies widely from less than 1 child in Monaco, in my right-hand side, to over 100, close to 120 child out of 1,000 dying in Afghanistan after birth. So it is very inequitable. So next slide. This slide is tricky. So Nidhi, you have to put in presentation mode and you have to click as I speak. There, it's animated. So right now, today, out of 5 children born in Burundi, Pierre lives to be 1 year old. Les, click. Les lives to be 36, Jean 57, Anne 72, and Sarah 84. Click. The same point of time, 5 children born in Sweden. Per lives to be 63, Lisa 77, Jan 84, Anton 87, and Sarah 93. Click. So we can see that this brings the life expectancy of people born in Sweden to 81 versus those born in Burundi to 50. Click. So this is a very inequitable and different, almost discriminatory situation. Depending on where one is born, it can be 50 years, live 50 years or over 80 years. And when we look at this chart, we can see that this has direct saying the income of societies. But even out of survived children, no, go back please. Even out of survived children, even those who survive, are they thriving? Are they developing to their potential? The data tells us no. Even in high-income countries such as ours, such as here in Canada, look at this. Is it on the y-axis? You see the income of the family. On the y-axis, you see early vulnerabilities. On the x-axis, you see income of the family, and you see as you go from high income to the low income, the rate of vulnerability increases almost by 3-fold for children. So the wealthier the families, the more developed children, and children of low-income families do not develop. So in this saying, government has a direct determining factor. Click. And this is not just situation in Canada. Click. This trend repeats in other countries. Click. Such as Australia, the same high income, middle income, and low income countries. The trend is the same, going from high income to low income, children become more vulnerable. Click. So, click. So, in recognizing this, in early 2000, WHO set up what we know today as Commission on Social Determinant of Health. Income is a social determinant of health. Maternal education is a social determinant of health. So WHO identified 9 knowledge networks across the world and assigned them to research one of these 9 social determinants of health. Our institute at the University of British Columbia was designated as WHO's knowledge network for early child development. Early child development was also recognized as a determinant of health. So the commissioner We took 2 years and did a vast research and submitted report to commissioner, and commissioner's report released in August 2008. Click, please. So this report is a monumental report. Click. Chapter 5 of this report is our chapter, and the overall message of the report is that social determinants of health are responsible for almost half of the variation in health outcome. Click. So this chapter of ours, Equity from the Start, is chapter 5 of this book. Click. And what happens? This is the nutshell message of this chapter. The message, the overall message is, if we don't take care of early years, the ramification will continue all across life. Click. If early years are not taken care, that will show in second decade as school failure, teen pregnancy, criminality. Click. In the third decade of life, it will show in obesity, elevated blood pressure, depression. In fifth and sixth decade as coronary heart disease, diabetes, and in older age as premature aging and memory loss. So this is how potent these few years are. And so we have to protect the environments of children during the early years. Which environments we have to protect? Environments matter for children, but which environments matter? And to respond to that, we gave this framework, which we know today as Total Environment Assessment Model of Early Child Development. This model basically says environments around children, from the most immediate, which is family, to the most distal, which is the global environment, they all have a saying in the developmental outcome of a child. So all these layers of environment affect children. So let's walk through these environments one by one. This individual child is in the center of it. Individual child is born with its own biological and genetic environment. Nidhi, please wait for me to say click. I think that's best way for us to proceed. So go back to the individual child, please, and wait for me to say click. Thank you so much. So individual children are born with their genetic endowment and biological inheritance. During this period of after birth, the system has to be watchful for detection of developmental delays in an early manner. Click, please. Then comes the environment of family. What happens within family? The maternal education, any depression, any mental health issue, any unemployment, substance abuse, they all have a saying in on the developmental outcome of child. Click, please. On our own data from Click, from about 1,000 children in Vancouver showed us this. This is on y-axis. We have maternal education from less than high school to university. On y-axis, we have cortisol level of children. Cortisol in children is an index of stress. As you can see, all these children are in low-income families, but going from a household that maternal education is very low to the household with educated mother at university level, the stress of children decreases by more than half. Yes, it decreases more than half. So meaning that even if the two households are dealing with marginalized income, with stressors of low-income family, when the caregiver has higher education and more informed, children's stress level can be reduced. And when children's stress level is reduced, their development is enhanced. Click, please. The next level is residential area. The area child lives. Is there a space for child to play and to explore and learn? Is there playground? Is there safe for child to play? These all have determining roles in child development. Click. The next area, this is what WHO model is about residential area, and WHO nowadays promotes the mixed neighborhoods. This is a very posh high-rise in Brazil, and next to it is its slum. And I know people in this high-rise probably don't like to be next to Islam, but having a high-rise like this in the neighborhood means that facilities, green area, playgrounds that children of these low-income community benefit. WHO is now promoting this model. Click. The next environment is relational communities, how grounded families are in their belief system, in their communities, in their religious gatherings. That's also important for child. Next. And then the ECD services, early childhood services. If the parents are working, are there good services with quality caregivers available to take care of children? Next. And next twice. And then the regional and the national environment are also important, because the laws and policies coming at both governmental level, regional government and national government, have influence on families raising children. What kind of unemployment policies in place? Can the mother get paid maternity leave? All these affect child development. So national and regional environment has a saying in child development. And lastly, the environment, click, of the global environment. What's happening globally? Globalization, for instance, or climate change, or just the current pandemic, they all influence children's development during the time that the world was dealing with this. So early child ECD, Team ECD model is a model we submitted to WHO, and then after that we started being invited to many different countries to talk about this model and how can governments operationalize and work with this model to enhance the early child development, and as a result enhance the outcome of population health, but also set the tone for economic prosperity. Click. So WHO, or World Health Organization, also identified early child development as the most potent social determinant of health among all of them. We get this right, we put the society on the path for prosperity. Click, please. So after this model was presented, this model, basically the message was that childhood is a continuum. What happens in kindergarten, click, carries over to the school age, and then over to grade, middle school, and continues to, click please, continues to till child graduates from high school. And UNICEF studies have shown that this chart, this graph, this is the stage of childhood on x-axis. On the y-axis, we have return of investment to society. As you can see, the best investment society can do is in preschool years, and that has about 7-fold return to the society if we invest in this preschool age. Click, please. However, this is where evidence shows to invest, but the societies usually invest like this dotted line. They start small and they increase. This is really counterproductive and contrary to what the evidence tells us. The evidence says most return to societies in early years, but most of countries tend to increase their investment in children as the child grows. Very little in daycare, kindergarten, early childhood education, but a lot in universities, building training professionals, building universities. So we're not saying that it's not important to build universities or invest in that age group, but we're saying that investment in early years will set up child on the right track and will not require much more investment when the child is grown up. Please. And the Convention on the Rights of the Child emphasizes exactly this and highlights the significance of early years. Please. So there is a concept called biological embedding that basically says what we just talked. Environments matter. Environments influence and impact greatly the growth and development of the child. Click, please. And that the same thing, the convention says the same thing. Click, please. The different language. The biological embedding is the language of science, and what the Convention on the Rights of the Child says is the language of human rights, that we must work to create equal opportunities for every child to maximize his or her development. Click, please. Oh, I think we're going to click all these. Okay, so yeah, this is a chart that really shows impact of environment on the brain, deep down on the genes, and the experience of child in an environment interprets and goes deeper and becomes gene expression. And this is all started by environment. Click, please. So this is, and then we know that the way to modify environments is through child-friendly policies and programs. Click, please. So this part is, and this part, click. This is what the science tells us, illustrating the pathway that environments affect children's development. And this is the part the Convention on the Rights of the Child obligates governments through policies and programs make sure children's development and environments are good. Early years matters and needs to be safeguarded. Please. But are we safeguarding it? For to safeguard early years, so could we go back to the previous slide? I know it's difficult, Nidhi. It's very difficult to throw the slides for somebody else because you're not in my brain. How would you know?
It must be difficult for you, not for us.
I appreciate so much. So what happens? Early years matter and need to be safeguarded. Are we safeguarding it? Not quite. And it's not the matter of just developing countries, even the high-income countries. Early years are overall dismissed and overlooked by all the stages of childhood. It really, so when the governments fail, who comes next? Really, the rescue point of children in the absence of resources from government is the community. Community has amazing impact and amazing role to play for child development. I am going to close the presentation with a slide, a comic. I'm using set of slides that makes the same point, the great role of community and the important role of communication and coordination between key players in community. So I'm going to share with you the story of mother duck. This is a mother duck with lots of young children, ducklings, you see. So mother duck sits on a trip and goes out to go from A to Z. In her path, there are good Samaritans who help her with some of the challenges. Click. And then there are some organized teams she crossed some paths, she crossed some roads, click, and then comes across some challenges. There are organized groups help her, click, And then all of a sudden it starts raining. And when it starts raining, click please, some dutiful workers in the city hall come and open the flood, say the water drains, to avoid the flood on the streets. Click please. And then look what happens. Mother duck comes with the tiny, tiny ducklings, comes across that drain. She doesn't have the capacity, go back please. She doesn't have the capacity to see really how difficult this will be for the little tiny ones to pass through. She doesn't have the capacity to think, to go around. And then she walks through and the ducklings follow. But see what happens. Look, please. She starts with 7, 8 ducklings and ends up with 2 only at the end. Look, please. The children leaked through system. The ducklings fell through the holes. And this story repeats day and day in many, many countries. Children leaking through the system. And it's only then we come to rescue. It's only then we put all our show and efforts and call everybody and to rescue the kids, the ducklings. Click, please. But if only there was a coordination and communication, click, between the players of this story, this disaster could be avoided. Click, please. So they really, the take-home message is that it takes a village to raise a child. Communities have to come together, not because it's a good thing to do, not just because it's a moral thing to do, it's a thing that makes us feel warm and fuzzy at the end of the day, but also because it sets the tone of economic prosperity of nations. Click, please. I started with a great Mahatma Gandhi, a great man of India, and I want to finish with another saying with another favorite leader of mine, Dr. Deepak Chopra, who also belongs to your land. And all this said, at the end of the day, I think as an adult, for a holistic health and holistic approach to life, we just have to be mindful of the power of our minds, the power of our thinking. In the words of Deepak Chopra, every negative belief weakens the partnership between mind and body. And when this linkage between mind and body is weakened, we are lost souls walking in the society. And a society cannot prosper with a cohort of lost souls walking. Thank you very much for bearing with me through this challengeful presentation. Thank you so much, Dr. Kutwal. I so appreciate you had a very critical role in this. Click the last slide, that's done.
Thank you so much, ma'am. Now, I would like to invite Dr. Gautam to present the vote of thanks. Over to Dr. Gautam.
Good evening to all the dignitaries. I am honored in thanking and presenting a vote of thanks to Dr. Ziba. Renowned to her presentation to a very larger extent. I know every one of us has benefited from your enlightened thoughts on the health, and you touch the aspects of benefits of a strong health for a betterment of the society as a whole. Thank you, ma'am. Thank you very much. I'm honored that we have such a great personality amongst us in sharing her thoughts with us. We are so very much thankful to you, ma'am. I am also grateful that to the revered principals of our colleges, 5 colleges, who have organized this wonderful session for all of us, so that we can be benefited from this and can share our thoughts with our students and our society. And thank you very much.
My pleasure.
Thank you.
Thank you, Dr. Gutham. Thank you. I appreciate. It's a pleasure to be with you all, and I hope that this is the start of a collaboration, perhaps between our institutions through the connection that's been created with Dr. Kutwal. I think she had enough insight to think that we could establish a partnership between.
Of course, ma'am, we are thankful to our principal, ma'am, that she has made contact with such a wonderful person, an intellectual person like you, so that we can have your services in the future as well. Thank you, ma'am. So nice of you. Thank you.
I look forward to that. And when next presentation, we will do a run the day before to make sure that the system is up.
Yeah, thank you.
Yes.
With permission of the August gathering and on behalf of the host college, Dr. Piali Arora, I would request our principal of today's program, the host from the host college, Dr. Nidhi Kotwal. Ma'am, would like to just in a quick few words, if you would just address to the gathering regarding today's session and the wonderful deliberation that we heard.
I just want to thank Ziba a lot. I'm so grateful to her for taking out her time and effort to be with us and share her thoughts and experiences. We are really going to have some more seminars and webinars with you in future. And from your lecture, we've just come to know how important the early years of a child is. And therefore, we need to lay a solid foundation full of love, support, and happiness. It is very crucial for their future life and relationships. Research has shown, as you have rightly put it in your slides, a strong correlation between early childhood development and how successful that child will be in future. With these words, I thank you once again for contributing a lot for your valuable insight into our webinar. Thank you once again, Ziba.
Pleasure, Nidhi. Thank you. If there are any questions, I can entertain questions.
Yeah.
I think we have loads of
students.
questions for students as well. And if I have your permission, Nidhi ma'am, I'll just request
Yes, sure.
our students to put their question first. Then we'll be coming up
Sure.
with questions from faculty as well.
Sure.
Students, it's my request to all of you. If you are ready with your question, you can put your questions to ma'am, Ziba ma'am. So before the students are ready, if the faculty member is allowed, I can put a question from my side because some of the queries even I have. And since we have Ziba ma'am with us, if I'm allowed, I can ask you my question, Ziba ma'am.
Sure, please go ahead. And I
Thank
want
you.
to mention that I'm here. I can only be with you another 25 minutes because I have another meeting to attend. So let's take most of it, hopefully.
I know.
Yes, ma'am.
ahead.
My question to you is is related to infant mortality. Is there any global survey research that has been done to predict the factors which are commonly seen in the countries all over? What could be the common key factors leading to infant mortality? This is my question to you, ma'am.
Yeah, good question. I mean, this varies from every country to country. More than half of the infant mortality the global infant mortality happens in Southeast Asian countries, and about 43% of it is in India, unfortunately, because it's such a vast country and highly populated. Even with India varies. For instance, lowest infant mortality is in Goa, and the highest one is Madhya Pradesh. So, Madhya Pradesh, am I saying right?
Yes, yes.
So it varies the reason varies, but usually within Asian countries, the number one, or some of the one of the key contributors to this high mortality is low marriage age. When women are married before their reproductive system is fully developed, the infant in the intrauterine development doesn't happen. to its food. Therefore, when the infant is born, is not compatible to live. It's still not fully developed. The other factors, of course, is the early years nutrition and the infectious disease, diarrhea, deficiencies like iron deficiency, zinc deficiency, which zinc and iron are two very, very critical minerals required for brain development. So in general, there are common factors, and then there are region-specific factors that varies from maybe something in Africa. In Africa, child marriage is very common, and that contributes a lot. Like at 9 years old marries a grown-up man, so of course that as soon as the child gets to become fertile at 14, she gets pregnant, and the system cannot carry that.
Right now. Even in the last slide, you have beautifully depicted the mother duck and the ducklings. And
Yes.
I guess this wonderfully depicts how our preventive process should be, like the primary prevention, the secondary, as well as the tertiary prevention. So my concern is how to team up all these whole process of prevention so that we can really save the early losses that or infant mortality that we are seeing. For that matter, it also creates a huge impact on the development of the child as well if the prevention system is not strong enough.
Yeah. When the governments do not have enough resource, the challenge becomes so much more. But also within the countries that infant mortality is high, fortunately, the connection and the cohesion, social cohesion is also high. The communities, like here in Canada, I can live 20 years next to a neighbor and we just say hi and bye in elevator. We don't interact. But this social cohesion and the warmth and human connection is more in the countries that infant mortality is high, because it's a very different culture. I have lived in India. I don't know if Dr. Kutwal shared with you or not. I've lived in India over 2 years, so I have a very soft spot to that part of the world. I am biased probably in my comments, but truly, child needs nurturance. Child needs to be loved by more than caregiver. The more people give this love, attention, and listen, the better child develops. That is the essence of everything. If we get that from caregiver, from uncle, from the grandparent, from neighbor, from the playground person, the more the merrier. Fortunately, in developing countries, this factor is in place, and the communities have to come together to really strengthen this factor. If the financial feasibility is not there, at least this factor can be strengthened, and the governments must make it a priority. Financial feasibility is not always the reason. Cuba is one of the poorest countries of the Latin America, but they have exemplary early childhood programs. So it's just a matter of prioritizing where do we spend the scarce money that it's available.
Absolutely.
Yeah, have to make early childhood a priority.
Very well. Very well. It was really a pleasure to listen to you, ma'am. You made things so clear. I mean, in such a wonderful deliberation and wonderful presentation for that matter. The concept of early childhood care is so clear. Rather, we need to have more of discussions regarding mental health care as well, because the physical and mental health development both are working in cohort so that a global developmental program can be arranged for this little children or in the growing phase for that matter.
I look forward to that.
Yeah.
Thank you.
Thank you, ma'am. Thank you so much, ma'am. So, Nidhi, ma'am, if we have students to ask their question, are they ready?
Can I ask something?
Please go ahead, Dr. Singh.
Ma'am, actually earlier we have this Earlier, when we used to go to our maternal uncle's village or to their home, we have this very affectionate environment. In the whole village, we used to go. Every home was our maternal uncle's home. Everyone is there as our maternal uncle. Nowadays, we are seeing that whenever we go, or our children used to go there, I mean, there is not that knitting of the relations within that village or within our own village. That knitting is that the social networking is not that strong enough. It is deteriorating day by day. No one else is concerned about the children. No one else is like we used to when we used to play something. So some other uncle is watching us. Then he used to say, "What are you doing?" They used to put the questions, or they want to control the things. They want to grow us in a very well mannered. But nowadays, I'm seeing that people are not concerned about the children of the other or community children. They're not concerned about that. How we can deal with that problem? That social netting is we are not putting up that effort in rearing all the children of that community. We are just concerned about, we are just self-centered. We are just concerned about our own children. We're not concerned about the community. We're not concerned about the children of the community. How we can bring back all those things in our society again?
Yeah, good question. I mean, this is common in many countries. When societies are struggling, when people are struggling just to bring food on the table, these issues become secondary. They become besides the point. I think education is key. Everybody who is in the area of pediatrics, social pediatrics, child community, people like us, when we go on the field and work, education and providing information to the caregivers, to the elders in the family is the key. We can't make people do anything that they don't know. People do better when they know better. And in order for them to know better, we have to supply information. Community education is key. In Pakistan, they have, a few years ago, Aga Khan University invited me, they hosted me, and I had a back-to-back few lectures. They have a system in Pakistan, and they took me to the centers to visit them. They call it lady health workers. These are not pediatricians who take a long time to become up and running and give service. These are girls with high school. They are quickly trained the basics and fundamentals of child development and child health, and sent to community, and they are from the same community. So they have the duty of educating parents and caregivers on nutrition, on breastfeeding, on the significance of play with children. Children's brain developed as a result of stimulation. Even a simple play like peekaboo, it makes synaptogenesis happen in the brain of children. So these lady health workers do all sorts of education, and there has been a follow-up study of the result of the lady health workers work after, I think, a decade or so, and they showed magnificent increase in the growth, in decrease in stunning increase in the early child development index, which is tested by standardized tools. So communities can get creative and have, I mean, Pakistan is a poor country. The region that these lady health care workers work is a very impoverished communities. It's comprised of very impoverished communities, but they have found a way to deal with that. And now World Health Organization always advocates for lady health workers of Pakistan, and other countries are modeling that system. So education, the short answer to your question, Dr. Singh, is education, inform, that everything can happen through when people know better, they do better.
Thank you so much, ma'am. You have explained it beautifully. Thank you so much.
We have a student with us, Mona. Mona, if you can just quickly ask your question and we'll wind up today's session.
Evening, ma'am.
Good evening to you.
Sorry, ma'am, it's network. It's my question.
I can't hear you, Mona.
Mona has muted.
Mona, we can't hear you.
उसको बोलो unmute करे.
Unmute. Mona, unmute.
My question is what are the risk benefits of digital mental health?
I didn't quite get it. It's breaking. Can somebody repeat that question?
Mona, if you can please repeat your question.
What are the risks? What are and benefits of digital mental health?
Your voice is breaking.
Did
And
you
he's
hear
asking what are the advantages of physical and mental health?
Advantages. Okay.
good mental health? What are the advantages of good mental health?
Yes, ma'am.
Yes, well, it's like you're asking what are the advantages of health? What's the advantage of being healthy? Being healthy will provide full enjoyment of life, will probably same as the mental health. Full health is defined by health organization as 5 domains of health. Mental health is one of them. Without mental health, we are not fully healthy. If we're not fully healthy, we cannot enjoy life. We cannot be good caregiver to our young ones. We cannot be good company to elder people. We cannot contribute properly to our society. And altogether, we are not fully healthy. We're not fully up and running, functioning member of the society.
So any other question? Abhi got a similar question in the YouTube link as well. We are actually streaming it live in the YouTube. So one of the questions, student also is asking what would be the best few tips for a good mental and physical health for early childhood developmental years.
For early childhood. So for this would be maybe for caregivers, because children are not amongst us and children are not capable although they are really capable, but we have to speak in child-friendly language with them, not in a language of science. They are very capable. So I guess the central message will be really pay attention, be present with children, be reading for children is very important. Every night, read. That helps the vocabulary development, that helps the communication, the language acquisition, but also helps the development of central nervous system, brain, and puts the foundation. The human brain, the child brain develops from bottom up. The simple skills has to develop, and the more complicated skills is founded on top of that, and the other one on top of that. Child has to learn to tie shoes before learning to do gymnastics. We can't change this order. So the early years, child has to listen, understand, just a little bit, listen to story reading before starting to read himself or herself. So reading is very important, play is very important, nutrition in early years is extremely important. Significance of breastfeeding cannot be highlighted enough. And above all, relationship nurturing is critical for children.
Thank you, ma'am.
Ma'am.
I think Nandini is asking a question. Nandini?
Yes, ma'am. Yes, ma'am. My question is, ma'am, how can I use distraction to manage difficult thoughts or feelings?
Could you, Nidhi, repeat that for me, please?
Ma'am, how can I use distraction? How can I get distracted from the difficult feelings or thoughts which comes in my mind often?
Okay.
Didn't get
So
it.
she is basically asking how can she have a better
Disconnect.
concentration?
Yes,
Yeah.
ma'am.
How can she have a good concentration? She can
Right.
keep herself distracted from the distractors in the environment. and be focused in her job or work.
I am going to refrain from answering that. That's not in the area of my expertise. I can only give you my opinion as an individual. I am not a clinician trained on that, but you know, everybody has distraction. As my individual opinion, you have to find a way just to stay focused on the job and reduce the external extractions. If you're reading a book, you should turn off the music. You should close the door if possible. This is my individual way of dealing with this, but I am by no means expert in that area. So don't take it as an advice of professional on this. It's just an individual opinion.
Thank you, ma'am. Thank you so much.
Thank
So,
you, ma'am.
Ma'am, there is a question
Yes.
from Dr. Shiv. He wants to ask that how mental health impacts imprinting during the childhood.
So it has a grave consequences. It has a great impact. Not only what is going on with child and his or her own mental health, but so much so the mental health of the close caregiver to child. Studies have shown that maternal depression has negative ramifications on children. So because one has to be in a healthy mental status in order to perform his or her duties as a father, mother, or caregiver. And then when this health is not fully in place, those duties are not fulfilled. And when those duties are not fulfilled, children suffer. This is my take on that. I mean, mental health is one of the top priorities. Before pandemic hit, World Health Organization announced mental health as one of the high crises of the world. So, and it's rampant. It's happening in every country. It's just happening for different reasons. In one country because of poverty, one country because of a lack of warmth and heat, much another country. But mental health is rampant, and one of the is still to this day, even though we are in pandemic and infectious disease and global pandemic is the top priority, I think the global pandemic has even made the situation of mental health even more dire. So the priority of mental health still remains high even during pandemic, more so during pandemic.
Thank you so much, ma'am. Nidhi, ma'am.
My pleasure.
yeah.
I have about a few minutes for another question. If anybody has last question, by all means.
So we'll just request our students if anyone of you would like to.
Okay, Ziba, I thank you once again, and I'm sure the seminar has been very profitable and fruitful to everyone present here. So we'll see you soon on another webinar, on another platform. Thank you once again.
My
Been
pleasure.
so kind.
My
Thank
pleasure. I'll look forward to that, and I wish you all a great seminar and a great rest of the day. Thank you, Nidhi, for
Thank you, Ziba. Thank
passing
you.
my
for-
slides.
God bless.
Hey, everybody.
Thank you, everybody.
Thank you.